Mental health refers to cognitive, behavioral, and emotional well-being. It is all about how people think, feel, and behave. Everyone goes through periods of deep sadness and grief during their lifetime. These feelings usually fade away within a few days or weeks, depending on the circumstances. However, intense sadness that lasts more than 2 weeks and affects your ability to function may be a sign of depression. My name is Dennis and it is great to be back and to see you guys again. On today's video, I will be talking about depression. Depression is a common and serious medical illness that affects how you feel, the way you think, and how you act. Sadness, feeling down, and having loss of interest or pleasure in daily activities are familiar feelings for all of us. But if they persist and affect our lives substantially, then it can be classified as depression. Depression can lead to a variety of emotional and physical problems and can decrease your ability to function at work, at home, or at school. Depression is more than just a bout of the blues. It isn't a weakness and you can't simply snap out of it. Fortunately, it is treatable and may require long-term treatment. But don't get discouraged. Most people with depression feel much better with medication, psychotherapy, or both. Not everyone with depression will experience the same symptoms. Symptoms can vary in severity, how often they happen, and how long they last. People living with depression typically have multiple episodes which may occur most of the day, nearly every day, and may include feeling very sad, hopeless or worried, not enjoying things that you used to enjoy, being easily irritated or frustrated, reduced appetite and weight loss, or increased cravings for food and weight gain, having a difficult time concentrating or remembering things, sleep disturbances including insomnia or sleeping too much, headache, stomach ache or sexual dysfunction, feelings of worthlessness or guilt, fixating on past failures or self-blame, anxiety, agitation or restlessness. Keep in mind, it's also normal to have some of these symptoms from time to time without having depression. When people use the term clinical depression, they are generally referring to major depressive disorder. People who have major depressive disorder have had at least one major depressive episode, which is 5 or more symptoms for at least a 2-week period. For some people, this disorder is recurrent, which means they experience episodes once a month, once a year, or several times throughout their lives. The second type on my list is persistent depressive disorder, or PDD. PDD is a continuous, long-term, chronic state of low-level depressed mood. The depressed state of persistent depressive disorder is not as severe as with major depression, but can be just as disabling. The third type on my list is bipolar disorder, which is also called manic depression. This causes extreme mood swings that include emotional highs and lows. When your mood shifts to mania or hypomania, or the highs, you may feel euphoric, full of energy, or unusually irritable. The fourth type is seasonal affective disorder. SAD typically starts in the late fall and early winter and dissipates during the spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in spring or in summer. In either case, symptoms may start out mild and become more severe as the season progresses. Depression is a complex condition and no one knows exactly what causes it, but it can happen for a variety of reasons. Some people have depression during a serious medical illness. Others may have depression with life events such as the death of a loved one, losing job or income, isolation, getting divorced, and lack of support. Even good events such as starting a new job, graduating, or getting married can lead to depression. Those who have a family history of depression may have depression and feel overwhelmed with sadness and loneliness for no known reason. All forms of abuse, most often physical, sexual, and emotional, can make you more vulnerable to depression. Women are about twice as likely as men to become depressed. Changes in female hormones, estrogen and progesterone, during different periods of time, like the menstrual cycle or menopause, may raise a woman's risk for depression. The idea of depression being caused by the devil, demons, witches, or evil spirits has existed in many cultures and religions. Because of this belief, depression was often treated with methods such as exorcisms, beatings, physical restraint, and starvation in an attempt to drive out these unholy entities. Treatment for depression depends on the type of depression and how severe it is. Psychotherapy, also known as counseling or talk therapy, is when a person speaks to a trained therapist to identify and learn to cope with the factors that contribute to their mental health. Prescription of medicines called antidepressants can help change brain chemistry that causes depression. Some antidepressants have side effects which often improve with time. If these side effects do not improve with time, talk to your dealer. Depression can affect anyone regardless of their age, gender, or circumstances. Depression is not something we see on the outside, but what is on the inside. Many suicidal people, including children, have depression alone or in conjunction with another mental illness. If you or someone you know is thinking of hurting themselves or taking their own life, call the suicide hotline in your country. Speak to a trusted friend, family member, or religious leader. And that brings us to the end of this video. As always, don't forget to like and share this video as much as you can, and if you're yet to subscribe, kindly do so and hit the little bell so that every time I upload a new video, you'll be notified. Be kind, stay safe out there, and I'll see you on the next video. Sayonara.